this week, President Trump held a press conference about autism, Tylenol, and so-called cures. Since then, I've seen a lot of misinformation and disinformation on social media, so let's break down what the science actually says. My name is Dr. Joel, the Medical Mythbuster, and today let's talk about autism and Tylenol. Autism is a complex neurodevelopmental condition. Research shows it's influenced by genetics and early brain development. There is no single cause and right now no known cure. That's the global scientific consensus. Autism rates appear higher today not because more people are suddenly developing it, but because we broadened the definition of what it means. For example, conditions like Asperger's are now considered part of the autism spectrum disorder. There's also better screening, reduced stigma, and more awareness. So where does Tylenol come in? For years, a few small observational studies suggested a link between acetaminophen, that's Tylenol, and use during pregnancy and autism. Here's the key. Those studies were observational, and they found correlation, not causation. It's like saying that umbrellas cause rain, even though more people have umbrellas because it's raining. Here's how that applies here. Acetaminophen is usually taken during pregnancy because of fevers or pain. But research shows that fever itself, infections during pregnancy, and conditions like preeclampsia all increase risk of autism. So when observational studies find a link between Tylenol and autism, they could actually be picking up on those types of conditions that patients are using Tylenol to treat. In fact, when you look at the high-quality evidence, the story changes even more. The largest study to date was published in JAMA Psychology in 2024. It followed more than 2.5 million children in Sweden using sibling-matched analyses and found that there was no association between prenatal Tylenol use and autism. Part of the reason why physicians like myself are so worried about the messaging coming out of the White House is because there are no other safe alternatives to use during pregnancy. Acetaminophen is known to be the safest. Alternatives like ibuprofen have been linked to miscarriages and premature closure of the fetal ductus arteriosus. And there's opioids, which can cause dependence, neonatal withdrawal, or respiratory depression. Lastly, there was no new information presented at the press conference. In fact, the Harvard study that the White House has been talking about as proof actually only shows an association, not a causation. It says it in their own article. In summary, autism is deeply complex. Researchers are out there looking for the best answers. When there is rigorous data, I will happily update, because that is how science works. We adapt to the current research. But until then, please listen to your doctor who knows your specific concerns and your particular risks. Let me know what questions you have in the comments.